All right, let's jump right into it. Dr. Linda Baker, Director of Medical Services at Gulfside Healthcare Services, and a lot of misnomers when it comes to the situation where that your services that you offer. In the past, we talked about one of the myths regarding that is this doesn't necessarily signify the end. It's just there's a lot of different ways you can help them. So let's start with your palliative care. Let's maybe give our listeners an insight on that.
Sure. Gulfside has 3 different service lines. We have home health, which most consumers are fairly familiar with. Palliative care, which I find most people don't know what services it offers, and also our hospice service lines, and we'll talk a bit about some of the myths regarding hospice care. But I wanted to start off by giving some definitions about palliative care. So I think I have a slide that you could put up.
Perfect.
Thanks, this Rob. Is a great definition of palliative care from getpalliative.org, stating that palliative care is specialized medical care for people with serious illnesses, and it focuses on providing patients with relief of symptoms, including pain and the stress of a serious illness, whatever the diagnosis is. So the goal of palliative care is to improve quality of life for both the patient and the family. Mm-hmm. And I have another slide with another definition, that says palliative care focuses primarily on anticipating, preventing, diagnosing, and treating symptoms experienced by patients with serious or life-threatening illnesses, and helping patients and their families make medically important decisions. The ultimate goal of palliative care is to improve quality of life for both the patient and the family, regardless of the diagnosis. Although palliative care, unlike hospice care, does not depend on prognosis, as the end of life approaches, the role of palliative care intensifies, and the focus on aggressive symptom management and psychosocial support also intensifies.
Wow. Yeah. That's interesting. It says a lot there. That's a lot said. And it's about the patient's health, but it's also about the family's health because they're the ones supporting that patient.
Yes. Advanced care planning and complex decision making regarding goals of care is one of the things that we really offer and specialize in palliative care, as well as doing symptom management.
Yeah, that's a big part of it, because the family's taking care of, the relative, and they're missing out on their days at the beach or the spa or their kid's soccer game. I mean, they've got to take care of this patient. So Gulfside Healthcare Services can help ease that type of family, dynamic.
I think one of the biggest things we do is really get the discussion started when patients have been diagnosed with a serious life-limiting or life-threatening illness, to get the discussions going about what their wishes are and what their goals of care are. And those are things that often, without the stimulus of a healthcare provider initiating that discussion, that families often shy away from making those decisions and having those discussions with one another.
Oh yeah, it's easier not to. It's just so easier just to gloss it over. Oh, check out the football game or whatever. Yeah, so the myths regarding hospice care: enrolling hospice doesn't necessarily signify the end. Hospice does not hasten death.
Correct. There are still people out there who feel that when you sign on to hospice care, that hospice actually promotes dying and actually hastens the person's death, where that is not the case at all. I tell families all the time, it's not my job to speed things up or slow things down. It's just my job to make sure that things are comfortable for you and that we make the best of every day that you have. That's my role as a hospice physician.
I like that. Yeah, making it comfort. There's nothing more comfortable than being in your home, buying, when you're in this position. I can definitely, understand that. The environment, the comfort of your bed, all the familiar surroundings help minimize a lot of that. Another myth regarding hospice care: hospice stops all the patient's medications.
Correct. One of the things we do very, very early in the process at the time of admission is have discussions with the patient and their family about what their goals of care are.
Right.
And revisit what is going on with the patient at that point in time, what their overall status is, and examine what medications they're taking, and to determine what's best to continue and what may not be in their best interest anymore. And that can have lots of implications for the patient, both health-wise and, of course, financially. Although another thing that people often don't understand is that once the patient comes onto hospice care, the cost of their medications, as long as it's within the hospice plan of care, is covered by the hospice. So that can be a huge financial relief for families.
Yeah, that's a whole other side of this thing. It's people probably think, oh, I can't afford that. They don't know until they ask the questions. Right. So another misconception or myth regarding hospice care is the team works with the patient to determine what level of symptom management is acceptable.
Correct. Another thing that I hear people say all the time is that we just medicate people to the point that they're unconscious, and in other words, again, hastening their death. But we really work with the patient. If I have a patient who is still driving, golfing, but has a terminal illness, he may tolerate more symptoms or, for instance, more pain as opposed to someone who is nearing the later stages.
Right.
And we work with them to determine a plan of care and work with their personal physicians as well.
Yeah, that's interesting. So later notes here talks about medical directors collaboration with interdisciplinary team to provide comprehensive care for patient and family.
Yeah. Our team includes our patients when they come onto hospice care are assigned, of course, a nurse, a social worker, a chaplain, aides if they need those services to help with personal care. Volunteer services are available, and a nurse practitioner as well as physician oversight.
Yeah.
And I coordinate with every member of that team on a regular basis to help adjust the plan of care, because as the patient's status changes, often you need to reassess what your goals are.
Yeah.
And try to help with that education process as well.
Yeah, that's important. We're talking with Dr. Barker here, representing the Gulfside Healthcare Services. You've heard Linda Ward on the show. More from our expert contributors here. When we come back, more from our expert contributors, and we also have a feel-good story of the day coming at you here on the Consumer Quarterback Show. Check out Gulfside.org for more information about what Dr. Lisa Barker was talking about. She's the Director of Medical Services with Gulfside Healthcare Services. All right, here we go. So top tips, nuggets of advice, parting words of wisdom, Dr. Lisa Barker.
I'd like to say that if you are a patient that's facing a serious illness, or a friend or loved one of someone who is facing a serious illness, be an informed consumer. Reach out to us. We have a wonderful website, Gulfside.org. There's contact information there. Our patient access department can help you with determining what your needs are and if one of our 3 service lines would be helpful. And again, like I said, be an informed consumer. Don't listen to the myths that are out there about the type of care that we provide, particularly in hospice care. Learn the facts from the experts.
Yeah, absolutely. Good stuff. Gulfside Healthcare Services, hospice, palliative care, home health. Dr. Lisa Barker on the Consumer Quarterback Show. Chuck Peterson, top tips.
Yeah, we'll go to the one we usually do is, again, be an informed consumer, right? Mm-hmm. So if you are signing a contract with any contractor, not just us, but anybody else in a construction type thing, make sure you do your homework. Make sure they're actually licensed to do the work. Don't give them 50% down payment. Don't give your money away. Check on things. Make sure that people are getting permits, doing the right stuff. I mean, you have to be accountable for a little bit of, work on your side as a consumer. So make sure you're getting somebody professional and do what they say they'll do, licensed.
Don't make it easy for the crooks. They come out and they look like they're doing something good. I remember the story last year. You said he came out and put five blue tarps on the roofs, and was this good guy.
They put $5,000 down a piece and left, never saw them again. Yeah. We ended up coming back in, having to do all the work, and they already paid out money, and you just feel terrible.
Wow, and I've heard stories too. You guys will actually do some of that stuff pro bono and try to help people out when you can.
Yep.
Yeah. All right, good stuff. Fred DeFelice, waterscience.us.
I think the big thing is, the water treatment industry. Somebody's going to come to your home and take about 2 to 3 hours of your time and kind of pressure you into buying their equipment. We don't do that. When we come, we're about 20 minutes tops. Mm-hmm. Test your water and show you what we can do for you.
Yep.
And then you make a decision the next day.
Yeah.
Just don't make that problem for yourself. And then I want to leave you with this thought. Teacher appreciation this week coming up. Right? So if you can read, thank a teacher. If you can read in English, thank a veteran.
Yeah.
And if you have an indoor toilet, thank a plumber.
There you go. I like that one. Yeah, that's a good one.
Thank you, Fred.
Thanks, Fred. 60-year master plumber. Yeah, that's a good one, man. I've also heard, if your child's giving you a hard time about teaching them or helping them with the computer, remind them that taught them how to use a spoon. Taught you how to use a spoon. I've used that one before.
Yeah.
So let's. I want to go back to Dr. Lisa Barker here, Gulfside Healthcare Services. One of our newer expert contributors on the show. As we mentioned, we've had Linda Ward on the show as well. Gulfside Healthcare Services. The parting words are great. I love that idea of what you mentioned there. But I think there's so many misconceptions around this home health care. I think we still had a couple to cover, but patients can still use their primary care physician. The cost, I think that might be a big one as well.
Cost. When you're talking about palliative care, and we do have an outpatient palliative care clinic that we operate in Pasco County, and we have patients that are from outside of Pasco County that do travel to our clinic. But your palliative care is covered just the same as any other physician that you see.
Okay.
So the same as going to the cardiologist, and if it's Medicare, it's a Medicare Part B coverage, where hospice care is covered under Medicare Part A. And of course, other commercial insurances also have a hospice benefit. But in general, hospice care is anything that is within the hospice plan of care for any illnesses that are contributing to the patient's terminal state is 100% covered by the hospice.
Okay.
So that is something that people often are concerned about. How can they pay for the home health aide that comes out to help with bathing because they can't afford private duty? Well, the hospice provides that for them at a reasonable frequency that can be accommodated.
Yeah. And that's good. And hospice is a philosophy of care, not a place.
Correct.
It's not a physical place. It's actually just a philosophy, a style.
Right. Hospice care is palliative in nature. So all hospice care is palliative, but not all palliative care is hospice. So we make a differentiation between our patients who are receiving palliative care that may not have that life expectancy of 6 months at that point in time, but still have a serious illness that they're dealing with, both the physical and the psychological and social aspects of.
Yeah, I like that. We should have you guys at our event coming up for the veterans. The veterans and heroes, first responders, EMS, teachers. We're kind of widening that umbrella as we go here. Seniors as well. It's a veterans event, veterans and heroes event coming up on September 12th. That's a Thursday, September 12th, 6 to 9 p.m. at the American Legion Post 5. It's Post 5 on Kennedy Boulevard, centrally located right here in pretty much the heart of Tampa, Del Mabry-Kennedy intersection right there in South Tampa. But I think there's going to be a lot of people there that could utilize some of these services and more information about this, especially, as Fred mentioned, our veterans, thanking the veterans. Captain Matt Bruce is a celebrity here in the Tampa Bay market. He's syndicated in 180 markets nationwide. He's going to be there. Attorney Joe Pippin's got the longest running radio show in the state of Florida. I think he's been on the radio for 26-something years. So we're going to have a wealth of knowledge and information in there, and I think it would be great for you and Linda to come and kind of maybe see where you can fit in and help out.
Thank you. We also have a special program within our hospice to honor our veterans, and we offer special pinnings for our veterans. Give them a certificate, special recognition, and things like that. And
nice.
Gulfside participates in there's a national We Honor Veterans program that's in the hospice and palliative care arena, and we participate in that and are currently at the highest level of recognition in that program that you can achieve.
Very cool. Yeah, that's great. Anything we can do for our veterans. One of the things we do with our real estate team, our Platinum MVP team at Keller Williams Realty, is we offer a quarter to a half a point discount back to the veteran. So whether they're buying or selling, we're going to give them money back at closing. It's our real estate commission. We can do what we want with it. So it's hey, let's give it back to our veterans when there is an opportunity for that. So we love to help the veterans, the first responders. The government gets a lot of things wrong, with a 10 to 12% approval rating. But one of the things they did get right is the financing that's allotted for the veterans as well. They have 100% financing options available. And there's a lot of misconceptions, when Lisa, when you mention, Medicare, this part, that part, even as a show host talking about this stuff on the air from time to time, it's still confusing for me, so I can imagine a veteran that's, got these stories that he remembers, these flashbacks, maybe some post-traumatic stress disorder, some of these things. How do they navigate these waters? So that's a concern I have, and that's why we set this event up. So September 12th, 6 to 9 p.m. It's online at Facebook. If you just search on Facebook, Veterans and Heroes, or go to Eventbrite, search Veterans and Heroes. It's online as well. It's our event that we're putting on. Catered food from Amici's Catered Cuisine. That's always a good reason to show up. Excellent food.
Yes, it is.
They do a great job, right? You've been to a few of our events.
Yes, it is.
Yeah, so we're looking forward to that. So that's going to be a good time, and make sure you bookmark our website, consumerqb.com. Follow the show online at Brandon Rhymes 1 on Instagram and Twitter. You got a Facebook page out there as well. Link up on LinkedIn. There's always a way we can connect on LinkedIn. And remember, about a week and a half, we're going to be on a different channel on 860. The Answer coming up. Just about a week and a half, we're going to be converting over to this station at the 4 o'clock drive time on AM 860. The Answer. Really excited about that move. Very large audience there, and we are excited about that. So, thanks so much to all of our expert contributors, our team behind the scenes putting it all together. We got a great team around here. We got Jose back there, James, Dimitri, Rob to my left, John from WeBeam TV has been a show contributor for a long time, helping us out with the putting together the TV show side. By the way, you find us on Apple TV, Amazon Fire TV, Roku, Sony TV, and about 85 other smart television outlets just by searching Binge Networks. Just search up Binge Networks on your home television, and you'll find our show. And, of course, YouTube, Facebook, Instagram, all over social media, and a lot of great content out there. So, pretty much anything you need, we've had it on the show, or we have a connection to those folks that can help you. So check out consumerqb.com. You can see links there to all of our expert contributors. We want you to please go out there and consider committing a random act of kindness. We'll see you next time right here on the Consumer Quarterback Show, consumerqb.com.
You've been listening to The Consumer Quarterback, Brandon Rhymes. Whether it's real estate, consumer, or financial advice, let Brandon call your next play. Contact Brandon Rhymes at 813-670-7372. That's 813-670-7372. Online at consumerqb.com. And join us next time for the Consumer Quarterback Show, weekday afternoons at 5 on AM 1380. The Big